I'm extremely happy to be part of this inaugural function. First of all, I should congratulate the Forensic Odontology Unit under A.B. Shetty Memorial Institute of Dental Sciences, Oral uh, Pathology and Radiology Department for organizing this unique webinar on forensic facial reconstruction. I congratulate the team for organizing this unique webinar and for selection of the topic, forensic facial reconstruction. As you all know, forensic dentistry is the application of dental knowledge for criminal and civil laws, and it's a study of dental application on legal proceedings. Unfortunately, this particular area has taken backseat. I think I should congratulate the dental school for starting the forensic dental unit. I think very few dental colleges are having this forensic dental odontology unit, and it has got a great role in supporting the assisting the investigation agencies in identifying of human remains and also identifying their age, sex, and even race and socio-economic status of the person who has been involved in this particular crime or who has died in accidents or crash. It's a very, very important part of the forensic exercise. And any other one of the very important, interesting, I was reading about the utility of bite marks left by the perpetrator of the crime on the victim or the what he has left in and around the scene of the crime. I think I was really surprised to know that a lot of very high landmark cases and judgments have been based on bite marks in the history. One particular example I could get from California in 1975, one perpetrator of very heinous crime had left bite marks. He had bitten the nose of the victim, and through that itself, they could identify the individual, and they could. That's particularly by having very sophisticated three-dimensional comparisons of the bite mark of the victim and the dental impression of the perpetrator of the crime, and they could confirm the crime done by that particular individual, and he was convicted for that. It's very interesting, and unfortunately, this type of evidence is not utilized in our country. I congratulate the department once again for. I think Professor Aman Chaudhary will have a lot of things to say about this, because this is very, very important thing. And even the DNA analysis is unfortunately not taken up very well in our country. I insist that both our medical school and dental school take some very proactive role in developing this particular area, and so that we can be a referral center in this part of the world for this type, providing support to the criminal investigating agencies, because it's one of the very important part of in the Indian Penal Code. It has been accepted that this forensic odontology is very incriminating evidence for fixing the crime. And I once again congratulate, and I hope all the participants, this very interesting webinar, will be benefited by the talk of our very eminent resource persons, Professor Aman Chaudhary and Professor Mahbalesh Shetty. Wish you all the best. May God bless you. Have a happy conferencing for the next, I think, few hours. It may be lasting the whole in the morning. I wish you all the best. Thank you very much for giving me this unique opportunity to participate in this webinar. Thank you.
Thank you very much, sir. It is an immense pleasure that you have been present here within the short notice. I really thank you very much, and thank you for your blessings. I now request our beloved Dean, Professor Dr. Krishna Naik sir, to address the gathering.
A very good morning to all of you. Most respected and revered Vice Chancellor of our university, none other than our own Professor Dr. Satish Kumar Bhandari sir, Professor Dr. Mahbalesh Shetty, the head Department of Forensic Medicine and Toxicology at Kshema, Professor Dr. Aman Chaudhary, the General Secretary of the Indo-Pacific Academy of Forensic Radiology, a person from our own fraternity, the Head Department of Oral and Maxillofacial Pathology at the Faculty of Dentistry, Jamia Millia Islamia, Central University, New Delhi, Professor Dr. Pushparaj, Professor Dr. Subhash Babu, the advisors of the Forensic Odontology Unit of our institution, and not to forget the pillars or rather the people who are responsible, mainly responsible for organizing this program, Dr. Kumuda Rao and Dr. Urvashi, the coordinators of the Forensic Odontology Unit of the university. All my other colleagues and participants who have logged into this interesting webinar, not something little out of the way, like our respected Vice Chancellor has said. We have been hearing to so many webinars on various topics, but something on forensic facial reconstruction makes it very interesting. And I'm sure with the two star luminaries that we have among the faculty, Dr. Mablesh and Dr. Aman Chaudhary, today's webinar is going to be one of its kind. And I will be failing in my duty if I do not congratulate our entire Forensic Odontology Unit for organizing this. And I once again implore upon all of you to start the certificate program in Forensic Odontology at our institute under the aegis of the Forensic Odontology Unit as early as possible. Believe me, as Sir has said, there will be a lot of takers for this science, though it's not a very new science. It is still in its, I should say, there are very few people trained in this across the country. So I'm sure you will take up my request, advice, or whatever you want to call it, and start this certificate program very soon. I'll be failing in my duty if I do not thank Professor Dr. Satish Kumar Bhandari sir for accepting our invitation and being the chief guest and inaugurating this forensic facial reconstruction webinar. Sir, thank you very much, and we are really honored to have you amongst us. I also would like to thank Professor Dr. Mablesh Shetty, our own very dear head of the Department of Forensic Medicine and Toxicology at Kshema, and Professor Dr. Aman. Thank you very much, Professor Dr. Aman, for accepting to spend your valuable time and share your valuable knowledge with all the participants. And I would not like to sound repetitive. The need for this webinar, the need for this knowledge about this science on forensic odontology has been stressed by even our Master of Ceremonies or the coordinator and our Vice Chancellor. And we have got two experts who are going to talk about it. So I don't want to sound repetitive. I wish the deliberations all the very best, and I'm sure our participants are going to go back richer in knowledge after this webinar. Thank you very much, and have a lovely interactive couple of hours ahead of you. Thank you. Have a great day.
Thank you very much, sir. Now we will proceed with our first resource person, Professor Dr. Mahabalesh Shetty, sir. He will be speaking on the role of forensic facial reconstruction in identification. He will be joining you at present.
Good morning. Good morning. At the outset, I'd like to thank the organizers for giving me an opportunity to be here. Friends, role of facial reconstruction and identification. I'll be talking about identification in skeletal remains per se, because it's a humongous topic, the identification. So I'll be dealing only with the what is identification and what to do about in skeletal remains, and the reconstruction part and all those things will be spoken by Dr. Aman Chaudhary, who is one of the known person in this reconstruction or approximation, facial approximation area. So coming to the topic per se. The necessity of identification is paramount, right from home to tomb. Having said that, friends, you may not be aware of the fact that according to the National Crime Record Bureau, in last 6 years, more than 225,000 bodies have been unclaimed or unidentified. That amounts to almost 103 to 104 bodies per day. Out of these 104 bodies, which as given by the police, there are this is just tip of the iceberg because so many bodies are not even come to the notice of the police. So out of these 100 bodies per day, it's a phenomenal number of 100 unclaimed bodies per day. Out of these 100 unclaimed bodies, 30% of the bodies have been disfigured due to putrefaction or skeletonized partially or completely. So the role of identification plays a vital role. For any crime, the failure to solve the mystery behind tens of thousands of unidentified bodies is contributing to the rise of percentage of unsolved murder case. For any crime, without the identification of the victim, it is not possible for the police to go ahead. With the identification of the victim, they can go ahead. But the problem, as I told, is among us almost 100 to 104 bodies, which is recorded. It's just the tip of the iceberg. There are many more bodies which have been submerged or which are in the forest area, which have been not seen, are gone unnoticed. Now coming to what is identification per se? The identification means determination of the individuality of a person, exact specification of an individual. The importance of forensic identification in the legal medicine has become evident and effective in playing a role in the identification of unidentified bodies. Identification of the criminals, estimation of age, sex, stature, race, and aesthetic functional loss. Identifying human remains of unknown origin continues to be a challenge of law enforcement authority and humanitarian agents worldwide. It's got both importance. One is legal and for the human reasons. Establishing the identity of a person, whether dead or alive, is paramount importance. As I told, both legally and for human reason. This is because the individual exists as an entity in the society and is dealt with such by the legal system. The personal identification is defined as establishing the identity of the individual. There's a primary and most reliable means of identification are fingerprint analysis, comparative dental analysis, and DNA analysis. All this thing is possible only when we have got antemortem and postmortem record. When you have got skeletal remains, the first and foremost, we should identify whose is it. The secondary means of identification include personal description, medical findings, medical record, as well as evidence and clothing found on the body. I'll be dealing with few cases which will know what is the importance of the skeletal remains. In the forensic context, it plays an important role in identification of the dead body where post-mortem reparation is made problematic. Like soft tissues are not often preserved, like fingerprint is not available, and facial analysis, all due to the decomposition or advanced stage of skeletonization. The foremost task in achieving the personal identification is to establish whether the skeletal remains are human or not. There are 10 points which I'm not going to discuss about it. First and foremost, whether it is human or animal. Then the fourth thing, age, stature, sex, and ethnicity. If the remains belongs to human being, then various anthropological techniques can be used to identify the dead. The big fours, as I told, determination of age, sex, stature, and ethnicity. These four things will form the tentative identification. So I'll just go in brief because a lot of dentists are there here. So what is the importance of identification in living person, in dead person, in skeletal remains? So what happens? We have got two things. One is complete identification. Yes, Mr. A is Mr. A itself. There is no ambiguity, no doubt. Absolute fixation of the individuality of a person. Then comes partial, when we have got only race, age, stature, and ethnicity. Other things are unknown. So we can go ahead with another thing, the positive identification. As I told you, yes, Mr. A is definitely A. There is no ambiguity. Then possible identification, where the antemortem and postmortem data have consistent features, but due to the quality of either the possible identification, antemortem and postmortem data have consistent features, but due to the quality of either the postmortem remains or the antemortem evidence, it is not possible to do positive establishment of dental identification. Insufficient evidence. The available information is insufficient to form the basis for conclusion. Then exclusion. Yes, definitely exclusion is paramount as a forensic expert, because it definitely say that this particular missing person is not this person. Is it? So now coming to the purpose of identification, we have got social, legal, and forensic reasons. Why to establish identity? Again, this is for very basic in the living, for civil, insurance claim, pension claim, inheritance, marriage, dispute, sex, missing person, so on and so forth. In criminal, absconding criminals, absconding soldiers, person accused of assault, murder, rape, etc., impersonation. The identification of dead is required in the need for personal identification arises in natural mass disaster like earthquakes, tsunamis, landslides, floods, etc. Man-made disaster like terrorist attack, bomb blast, mass murders. Cases where the body is highly decomposed or dismembered to deliberately conceal the identification of the individual. The 5 methods of identification, as I already said, one is visual, fingerprint, DNA analysis, anthropology or radiology, and dental comparison. This is the way we proceed when we get a skeletal remains. The forensic odontology comparison with the antemortem dental record is commonly used to confirm identity, but provided we have got antemortem dental record. If you don't have antemortem dental record, having only postmortem dental chart doesn't help us. So nowhere we can proceed. We can just give the clue that there is a prosthesis, there is an impacted tooth, there is implant or whatsoever, but it's of no use for this police. At the end of the day, it is the police who has to go and search. It's not the doctors or not the forensic experts. In contemporary forensic science, corroboration will be achieved by DNA analysis in comparison with the reference sample from a family, or by the cloths, or by the intimate things what the person was using, or with the DNA analysis, or with the fingerprint, or with something which the person has left antemortem. But here, in the, when it comes to DNA analysis in a bone, we get only mitochondrial DNA, which we have to go with the maternal lineage. Thus, the primary and most reliable means of identification are fingerprint analysis, compared dental analysis, and DNA analysis. Friends, fingerprint analysis is ruled out because there is no soft tissues. Compared to dental analysis, again, if you have got only antemortem dental record, we can compare. DNA analysis only when the identification is fixed, then only we can go for DNA analysis. Then what is left? Now we have to create a face for the skeleton, for the skull, and just give a publicity whether this person is have you seen this person? The secondary means of identification include personal description, medical finding, medical record, as well as evidence and clothing found in the body. The identification of bodies may be challenging in mass disaster, like we had in Mangalore air crash. But the problem here in Mangalore was that it was only the people who were inside the plane were charred. But certain times what happens, plane may fall on the road, plane may fall on the market or on the house, so that many people other than the inmate, occupants of the plane will go for be charred or maybe dismembered. So then the problem of identification arises. So this is the body that we found in a plane air crash. This is a very Herculean task for us, whether it's an inmate and all those things. Even the DNA wouldn't have given much importance, but again, the bone has helped us because of mitochondrial DNA. And this particular case, this is a case which has been brought from some other part, some other district and dumped in our district, where when you see, you will be able to say that if the layman sees, yes, there is a pant, there is a shirt, so why not we can identify. Friends, this particular case was strangled and was dumped in a forest where only shirt and pant were there, but the shirt didn't have any tag other than the size, that is 32 or 34. The pant had no tag of Taylor or whatsoever, but only the size of the pant we could say, but underwear was there, which was mentioning jockey, but everybody from north to south, east to west, underwear, jockey. So it's not possible humanly going in search of underwear. But as a forensic expert, we told the age of the person was so and so, sex of the person, stature of the person, and definitely the ethnicity belongs to our area. So based on that, we have given a clue to the police that this is the height, this is the weight, this is the person. And almost 10 to 15 districts, they have given the photos and said that this is the person missing. And in the end, they identified the person who was missing. Based on that it was a strangulated case. But we couldn't give the cause of death to strangulation, but it was almost skeletonized body. So here, the facial analysis is difficult. What we can say, we can't just identify. There's no clots on the body. The fingerprint could not be taken, nothing. And based on the just skeletal examination, we could say that this is the person, his age is so much, his height is so much, his stature, all those things, and we have given this thing. And this is the fit case for facial approximation. If not for facial approximation, just by this we can't go. As I told initially, that in India, per day, 102 to 110 bodies are unidentified. And out of that, 30% don't even have photos, because the body has been dismembered, decomposed, disfigured, or skeletonized partially or permanent. As this case also, this was a dump body in the deep forest where we recovered the skeletal remains. Again, this was a strangulated case which was identified later based on our age, stature, sex. We are given all these clues, and based on that, again, almost 15 to 16 districts the police had sent all over India. But you know as how the police work, because the investigation and bandobast are the same police. Actually, what I feel is that there should be a different wing of police only for investigation. Then only all these things can be solved. But here what happens, investigation is done by the same police, bandobast is done by the same police goes for the VIP protection. So at the end of the day, nobody is there for investigation. The unusual medical history involving trauma or surgery affecting the skeleton may offer a potential alternative if neither DNA profiling nor dental comparison are undertaken. This particular case which I am talking about here, this particular case had an implant, and the police got this body and given in the age, stature, sex, and we are just told just couple of years back, just one to 2 years back, he had a fracture, because based on the callus formation, we are told it could be just 1 to 1.5 years, and almost 500 hospitals, this police, because it's a murder case, because there was a fracture of the skull, so which suggested that it could be murder, because the injury was above the brim of the hat and the vertex, there is a fracture. So based on that, the police went in search of orthopedician, more than 500 orthopedicians they consulted. And in the end, based on our opinion that he is 25 to 35 years old, fracture of the, only one fracture where the implant was there, which was on the medial malleus of right tibia. So what has happened? Based on that, they came to conclusion of only 23 bodies were 23 addresses they got, and they went to each house, and one particular person was missing, and this particular person was murdered by his wife with the help of a paramour. So thereby we could identify. So this also helps. And this case also we can see intramedullary nailing here. This also was a murder case which we identified based on the intramedullary nailing, where we gave the stature, age, sex, and based on that police went in search. Now all the cases depends on the investigating officer. If he has got time. If he doesn't have got time, nothing is possible. This is also a very famous case, missing Spaniard. Based on this congenital anomaly, translational sacralization of lumbar vertebra, based on this particular thing, is a congenital anomaly which we told that it could be this particular person, and based on that, it was found that there was an antemortem record and we could identify this person. So it was also a strangulation case. It is important to note that the identification of victim is a single attrition point. The homicide investigation, identification of the victim is a key contribution that forensic anthropology and facial reconstruction can make to case conversion and progress. Identification of dead victim often helps the police to trace the victim movement to know his or her background. Without the identification of the victim, no way police can proceed. So half the case of heinous crime goes unpunished in our country. This is also a case of 18 to 20 years old girl who was dumped in a forest area. Just 20 to 25 days it was skeletonized. Our textbook says it takes 2 months, it takes 3 months, but this particular case was just 18 days it was skeletonized because of the animals, nearby forest animal like wild boar and cheetahs, all those things, it was skeletonized, and we could tell the age, sex, stature, and based on that it was identified on DNA. The question may be reasonably asked, why not just DNA, use DNA? Why all this headache? Yes, friends, I told again and again, to use DNA, you need something to compare. Without comparison, you can't go ahead with DNA. With whom you are going to compare? To compare, you have to identify. This is the only way you can identify is by facial reconstruction or approximation. Once you approximate or reconstruct a face and put it in the public domain, there are no two faces are identical. That's one thing you should know. Even the twins have got some features different. So first, the value of forensic facial reconstruction in missing person case highlights by this very question. The final frontier, the forensic facial reconstruction or facial approximation. I'm not going to discuss about this thing because I have not done facial approximation per se, but Aman Chaudhary is a known person, he will talk about it. So the forensic facial reconstruction is a process of recreating the face of an individual from the skeletal remains through an amalgamation of artistry, anthropology, osteology, and anatomy. Friends whose face is unknown. If you know the face, then you do reconstruction, it is different. If you don't know anything, you are just giving a shape and you may ask whether it is right or wrong. Forensic facial reconstruction is a combination of both scientific method and artistic skill. It can be used to reconstruct the soft tissue into the skull in order to obtain the image of the individual for his or her recognition and identification. The process of creating the face of an individual onto a skull for the purpose of identifying of an unknown person. When all usual method gets exhausted, identification have failed, and the skeletal remains are the sole data available for leading to a positive identification. Facial reconstruction might be considered as an enhancing tool for recognition. I, for one, believe that when all things are exhausted, yes, why not give a try, and definitely it is going to help. It must also be noted that facial reconstruction is not a method of identification, rather a tool for recognition to produce a list of names from which the individual may be identified by DNA assessment, dental record analysis, or other accepted methods of identification later. Once we know that this is a person, once this particular reconstruction is done, you send it in the social media, someone or the other, close or near or dear, may identify, and they may say, yes, this could be that particular person missing, and later on DNA assessment can be done. Having said that, when we give a skeletal remains, we always preserve for DNA, but I am not sure because India is a population 135 crore populated country, and as I said in the beginning of my talk, 100 to 110 bodies are missing per day. We don't have that much of space to save the DNA because our labs are not that so great that they can save so much of DNA. And we don't have database of DNA like the developed countries. Okay, once we have got data of the DNA, then definitely this is going to help us. In the last option of forensic investigation, when the routine channel of assessment have already been pursued with limited success, then only source we have got is facial approximation or reconstruction. When combined with publicity campaign, facial reconstruction from skeletal remains may lead to recognition of member of a public and hence to lead to identification of the individual. This is what we are supposed to go ahead, and future is with facial approximation or reconstruction. Without question, facial reconstruction has been a valuable tool for forensic investigation, and many individuals have been successfully identified as a direct result of publicity campaign employing a facial approximation. So friends, because of the social media, we can just put it in the media that this could be the person who has been missing. But yes, if it is a nearby district, 1 or 2, 3, 4 nearby district, neighboring state, yes, a person missing from Kashmir, his skeletal remains found in Kanyakumari. I don't know whether we will be able to justice even with facial approximation. In these instances, publicizing a forensic facial reconstruction and an accompanying physical or other circumstantial information may be critical to a putative identification being put forward, which can subsequently be corroborated by more reliable scientific means. Then Sheena Bora case of 2015. In this case, the accused himself has told he has dumped the body there, and the police recovered the skeletal remains. And in this particular case, directly they could have gone for DNA analysis, but they tried superimposition and they were successful because they had the antemortem photo. But in this case, when the accused himself has identified the place where he has dumped the body, and police identified from where they picked up the body, and based on this, they have done superimposition and they were successful. Though the DNA result will ascertain this detail, superimposition is equally important as evidence. And this particular case also, DNA was taken only once the body was identified later, not the initial period. Whereas in Western country, they always preserve the DNA the minute they get the skeletal remains. Hikari serial killings, 18 kids were missing, and again they tried say facial reconstruction, but it is a small number, 18, and nearby places, so it was helpful by DNA. So I just like to add a few words about this famous case. In 1980, the death of Dona Gael Brazil was missing. She was missing. Her body was found in somewhere in a forest area. It was considered as a rape and murder. It was a very heinous crime, but they couldn't find out who was this because it was almost 2 to 3 months and the body was almost skeletonized. Based on this particular thing, they tried all the level best, but they couldn't find who was the victim. The Louisiana state, but they collected the DNA and they kept the DNA, stored it very properly, and reconstruction was done, and it was put in the social media. After almost 30 to 40 years, decades later, her grandmother saw this particular thing and she told, yes, it could be my granddaughter. Based on this particular thing, they identified the victim and they caught hold of 2 people who had done heinous crime, rape and murder, and they are in the jail for almost 40 to 50 years. Punishment has been given in the Louisiana court. I'm not going to talk about the reconstruction part. So, but we are doing a research on the facial soft tissue thickness in facial approximation in our center, where you're using CBCT, because CBCT, the gravity part is not there, better than any other thing, MRI or CT, we are using CBCT. There are almost 21 points. We are taking measurement thickness. Previously, they used to prick the point and bony pointer and get the thickness. Once we have got all these measurements, definitely we have got a data. If it is a South Indian, if it is a Mangalorean, if it is a North Kerala, if it is a Mulbari, all those things will help us in the thickness of the facial thickness and help us to come to conclusion, which is the future. Facial reconstruction approximation with the data is the future, and we are done with 100 cases. Slowly we will be publishing it. This is what we have done, where all we have taken measure of 21 measurement, and it is a 3D construction. It's going to help us. So that is the future. Having said all those things, I would just like to conclude. Forensic facial reconstruction is a rapid, non-invasive, and efficient method where reconstruction can be repeated at any time if required. This technique is not only used for identification of individuals from skeletal remains, but is also used for surgical repair of faces, archaeological research, purpose in other software application where face detection is applied. Having said all those things, the future is facial approximation, because India is going to be a developed country shortly, and as I said, our population is 135 crores and unidentified bodies almost 100 bodies per day, and it may definitely go ahead. And having said that, thank you for patient hearing. I'd like to conclude. Any questions, you can just put it in the chat box. I'll try to answer with my limited knowledge. Thank you. Thank you. No, it's not it.
Thank you, Professor Dr. Mahavir Shetty, sir. It was a very nice and informative session. Sir has highlighted the actual problems and the indications for and the role for forensic facial reconstruction in identification in a very nice way, and he has given live inputs on the same. Now I would like to introduce our next resource person, Professor Dr. Aman Chaudhary, from Faculty of Dentistry, Jamia Millia Islamia. He is also the General Secretary to INPAFO. He has numerous academic degrees, and he has undergone a lot of professional development programs in various methods of that is forensic facial reconstruction. He is also the fellow to Indian Council of that is Indian Association of Forensic Odontology. He also undergone diploma in National Institute of Health and Family Welfare. Also, he has undergone training in forensic facial approximation from Central Forensic Laboratory, Chandigarh, that is from the Ministry of Home Affairs. He has undergone training for teachers in the UGC of the Jamia Millia Islamia. Recently, he has also undergone and trained in computerized forensic facial reconstruction from Tübingen University, Germany in March 2020. We welcome you, Professor Dr. Aman Chaudhary, to this webinar, and we hope that all will be benefited from the forensic facial reconstruction program. Initially, sir will be talking about the basic methods of forensic facial reconstruction, followed by the advanced methods of forensic facial reconstruction. I welcome you all and looking forward for a great session. Thank you.
Hello, everyone. Am I audible?
Yes, yes, you are audible, Dr. Aman Chaudhary.
Okay. I see a little disturbance. I request everybody to mute their mic so that I can proceed a little conveniently for everyone. First of all, I'll share the screen and then we can start with the thing which we have gathered for. Just a moment. Share screen. Is the screen visible? Dr. Komuda, is the screen visible so that I can proceed?
Yes, yes.
Okay. Good morning, everyone. Okay. Thank you so much. We will proceed now. Good morning, everyone. And on the outset, I have tried to add a little Kannadiga touch to my presentation. I have tried to Google Translate. If something goes wrong in the translation part, I am hardly knowing what I have translated to. But just for adding a flavor of a South, because we tend to draw our own conclusion that we are Dravidians, we are Caucasians, we are Mongoloids, and there will be a lot of that when we discuss today. Sir has already, esteemed speaker who was earlier to me has already cleared everything which I had to start with. He has introduced me, my topic so well that my half of the job is done. The thing which we are talking about, advanced and basic, that drawing line he has already, he has totally removed that. So I'll proceed with a very easy things, and then we will add some flavor of a little tougher things of technology in it. So this is what exactly is today's people have joined in from every part I can see of Delhi, of India, of South, of North. So I welcome them all. After welcoming them all, I need to really introduce you to the team, to the people who have been instrumental in pushing me to a place where I am right now. Professor O.P. Jasuja, Professor Dr. Priyanka Kapoor, Dr. Deepika Bablani Popley, and Dr. This is a student to me who has contributed in this presentation. When I talk about all this, you will see a forensic science touch, you will see a dental anatomy, dental anthropology touch, that is, and then there is a lot of orthodontics in it. I could see Krishna Nayak sir. Long back when I went to A.B. Shetty, he was there. He might not even remember when I was doing my post-graduation. I met him. Now that I can really boast of that, a lot of orthodontics will be there, and he will be really proud that his subject can contribute so much to this, and that's one of the reasons why Professor Priyanka is so active in my thing of my every venture which is there, because a lot of data is with her and a lot of things she can manage. She makes life easy during that process. This is my, I've already been introduced, but I will be failing in my duty if I don't tell what exactly, how I've been trained. Many of the trainings I've missed, but these are the prominent ones. I was introduced to forensic odontology by Ashish Acharya, sir, and then I was introduced to Facial Identification by Professor Jasuja. Then I was fortunate to work just before retirement with Dr. Sanjeev Daisy. I could see, sir, the previous speaker, sir, was telling that, he's doing some kind of a facial thickness thing. If you search, the first article which will come is Daisy Sahani and Sanjeev. That is Dr. Sanjeev's wife, Dr. Daisy, and Sanjeev, who have done an MRI-based study on the facial thickness. We have already got ethical clearance. India being a diverse, multi-diverse kind of a race or kind of a thing. So where we can have a multiple data sets, and we can be present there. And coming to the Tübingen, then it was Germany. That's where the training happened of reconstruction. So talking about this is a mixture of art and science, and I will be failing in my duty if I don't add the people who are really pioneered. The first picture which I see on the top is C. Wilkinson and Karen Taylor, who is a combination of art and science, one being a forensic artist and one being a very eminent, very vigorous writer who is there, who keeps on publishing on. And then down you see is Dr. Jasuja along with Dr. Salma Eka from Turkey. And that's how these people have been pioneers and really working hard when there was nothing in the subject. They have implanted so much of enthusiasm and zeal into this. How did I get introduced? I was more of a facial painter. I used to paint, and a lot of art was there, and I never knew that it could have been. I never knew dentistry could be added to a forensic aspect, and then I did not know forensic could be added to the facial aspect. So it has been a really combination of all these three, blend of art and science. I request you not to take any screenshots of the patients which are there. I have permission to really teach, but not to disseminate of them, just to avoid, to respect the dead. Do not end up really, making them a public, thing to be. And moreover, you have people in your friend list who are not forensic people, who are not medical background. So it is little, unprofessional to share those pictures. What do we learn today? We learn osteology. It has been introduced again. Dental profiling, skull alignment, FFSTT, that is the forensic facial soft thickness we talked about, facial reconstruction, and 3D virtual world reconstruction. That is the virtual reconstruction which is taking place in this. So you can really stop me for a 2 minutes or a 3 minutes break in between. There is nothing like an advanced and a basic thing which will happen. I have seen that I could have divided it into basic, and I am glad I did not do it, because sir has already totally taken care of the basic part which is there, to introduction to forensic approximation and how a framework can be used. Now each face is unique. There are around 7 billion people on earth, but each of them has a different and a unique face. That's why human face can be used as a reference of in its verification. That is a biometric thing which we talked about. And human have more variable on their faces than any other species. In the human body itself, the face has largest variable compared to any other body part, such as arm, leg, ear, and others. That's the reason that there is so much prevalence of biometric attendance which takes place. You can just show your face, even your phones which are there are biometrically opened just by your showing a face. Now there is a fingerprint also thing is there. So these are all identification things. If a phone can identify, why can't we use that technology in identification as well? But the only problem is that these all identification takes place on soft tissue, and within the moment the person is dead, these start to putrefy. They start the body enzymes as well as the outside external environment starts to degrade those body parts. So very difficult. That's where we come into picture, how to go about. We are not Sherlock Holmes, mind it. We are not Sherlock Holmes. We don't use much of brain in it. We use more of technology in it, because logics really is not of valuable in the court of law. What values is that how much times it is correct, how much time it is positive, and how much is your science valid. Actually, they believe in, and you have to be safe yourself also. You cannot go about giving lame statements which can be proved later on that you were on the wrong foot. So face can be discussed on various scientific domains, including physical anthropology, forensic anthropology, facial anthropology, archaeology, forensic art, anatomy, medical art, craniofacial identification, forensic science, forensic dentistry. All of them are playing a vital role. And I really I acknowledge my gratitude to the A.B. Shetty, has been a really thing that they have promoted such an important topic to me, as well as to people, as well as to forensic science, for giving a chance for me to share my passions. And I thank Dr. Pushparaj, I thank Dr. Krishna Nayak, I thank Dr. Kumuda to really give me opportunity, and they have brought together all these branches on a same platform, and I can talk to them that this is possible. This is really possible in a place where hundreds of bodies lie unidentified, and lots of them being charred, and people are having a cold cases which are not closed ever, and people or their relatives are waiting still for the body. A mother will not stop waiting for the body till her dying day, for the kid which is missing. So we have to really, it is very important to close the case also, that a person has died, why should we search for him? India is a land where burying and burning of a body is also important. We are very emotional people. We are not those, we respect the dead so much. That's the reason is socially we are so we are proud of our country because of that. We are so socially bound together with each other. So if I'm telling you to identify a person, you will be easily, this is one of the world's most powerful man in the center. He was the president. So Barack Obama, we can identify very easily. You can see so many faces. You can identify me next time you see me. So what about this? Will you be able to identify now? Not at all. Not at all. But A forensic person will be able to tell you age, sex, ethnicity very easily from these. How about this? Not at all. Not possible for many of the forensic people even. So that's where forensic odontology will come into picture. They're going to be telling you from this what exactly will go on. That's how things are going to be. That the science plays a very important role when we are giving an identification when we are giving a name to a body, when we are giving an age to a body, when we are giving a sex to a body. That is very important, because teeth and bones do tell tales. So we have to really be equipped for that. So ID from teeth. How do we go about identifying from teeth? Identifying from teeth, especially, it is not my topic right now to really go about, because I'm just introducing you how to go about. Now there are many people who have forensic background here. They must be doing comparative as well as reconstruction. Once there is you have an ante-mortem record, you do a comparative identification. You have ante-mortem record, you compare it with post-mortem records, it becomes a comparative identification. But if you do not have anything like that, India is a land of 1.3 billion people, and heinous crimes happen. They might happen in a place, the body might be disposed in a place where there might, like I had a case where a traveler got missing, in Himachal. So it will be he was from Nepal. So getting a person of ethnicity of Mongolite made my life a little easier. So you have to really keep in mind that ethnicity also plays a role. Age also plays a role. You will be ruling out so many people once you have an age, sex, and profiling happening. So this is where we fill the form, Interpol forms which are there. Now I will be really deviating from my topic, really talking about teeth as such, because we are not here for forensic odontology as such. We are here for forensic approximation. So deriving age, ethnicity, and sex from teeth, and that's what we are going to be doing from the bones. So that's how I end up writing a paper with my team that got published, and I presented it in Belgium also, in Leuven, where I presented that a forensic odontologist can be added to the team of facial reconstruction, because you are taking opinion of age, sex, ethnicity. We know how to use those materials, the dental materials which are being used. You see the replication of skull which is happening. There might be rocket science, but when I was training, I saw dental stone being used. I saw modeling wax being used. I saw alginate being used. And for them, it is, for a forensic MSc person, it is like, it's a new world. Our first year, second year person knows how to mix a GIC or materials. So that's the reason you need to really understand that and CBCT, IOP, we know everything. We know everything which will be used in forensic facial approximation, a basic thing which is being used, and anatomy, of course, first year. BD Chirosia, you're mugging up, you're using various books, you're drawing diagrams. That's what is exactly what will be required now. So compilation, as per Dental Council of India, I've compiled and what skills can be used in forensic approximation, and we'll be discussing about forensic approximation now. Take home message that you can include, they can be included in 2D, 3D, and we require collection of population-based data. That's what Sir also emphasized previously, that you require a population-based data which is there, and then you can have a team placed which is there for FFA. So what you require? If you want to rebuild a face on a framework of skull, you require a population base, because every 40 kilometers our food changes, our environment changes, our genetic makeup changes, maybe a little bit of them, but a lot of things change. So even the facial profile changes. So we need to have the thickness at each point. Sir told 21, 10 midline, I think 11 midline, and 10 bilateral points which are there. You need to have the data, amalgamated average data of that points, whether it is CBCT based or there are people who are doing on lateral cephs, they are doing people, and that's again where orthodontists come into picture. They are so meticulous in maintaining data. They are so meticulous in having pictures. They are so meticulous in maintaining of records. And even nowadays they digitalize it. So they make our life so easy. So let's explore skull first. What exactly? Because you have already read about it in first year, second year. There are people who are doing anthropology. There are people who are doing oral biology. They all learn about bones. Then growth and development and facial proportions. Why do we need to know about bones? Because we'll be reconstructing on it. Why do we need to know about growth and development? We need to know about growth and development. Why? Because you might be given a picture of a 14-year-old who got missing, and you might be, it might be late, around 5 years. He or she has grown now. You should know the growth spurt, how she will look later on, or maybe the dead body which is there, or the ante-mortem records which are available might be of quite young when she was there, when she was started with her orthodontic treatment, or maybe the casts which are there. So you need to know everything, how to go about the growth and development takes place, and the two words are there, growth and development. For a layman, it is both. It is increase in size. But for us, growth and development are two different major terms. What is the difference? Need to know about them. And then we need to know about facial proportions. Again, orthodontists really divide and they design the smile, use their knowledge, involve them. They are the best people who know about the smiles. For us, it might be at 1, 2 mm, no problem. But for them, every mm counts. So that's the reason they'll be really putting those braces and those tightening of screws, etc., etc. So bones which are there, they can be the bones which are there are in pairs. There are 8 cranial bones and 14 facial bones which are there. 8 cranial bones being frontal, parietal, that is into 2, that is temporal into 2, then there is occipital, sphenoid, ethmoidal, then there are 14 bones which are there, nasal into 2, lacrimal into 2, palatine, that is zygomatic into 2, nasal cochlear into 2, then there is maxilla, mandible, vomer. When I say into 2 means there are 2, so they're coming 8 plus 14 is exactly the number which comes to. Now you need to know the pit pat, how which bone touches what, how they look like, where is the foramen, the pain which you went through in first year of stillet, putting a stillet, and what passes through this and what passes through that, and when does the suture fuses, and why is it male, why is it female, what is the how does the orbit look like, what is the occipital eminence look like, what is the styloid process look like, is it touching, is it elongated, how is the gonial angle, how is the mental, how is the mentalis, what is the incisal distance which you are feeling. When I was being trained, for people who are untrained from dental background or medical background, it's a fairly painful training for them. For me, it was a cakewalk because I've been teaching 15 years for dental anatomy, anthropology, as well as dental anatomy. Now I realized, I always used to feel, why am I teaching students? Now I realize that, those teaching, when you're teaching, you're revising also. So my life was much easier during my training program. And for the first time, I was a very bright student. Finally, I was taken as a very bright student because they did not know that they are learning for 6 months or 3 months or 2 months. And I am learning since around 17 years. So maybe we add MDS and then it might be 22 years maybe. So a lot of things went through in training process. As I said, growth and development are two different things. Growth is quantitative and development is qualitative and quantitative. It will be beyond my scope of this lecture to really train you, a pediatric person, or you can ask Dr. Priyanka to really take over, and she can tell you what exactly is growth and development. They have immense training in it, but then little bit is required when you are reconstructing. That Bolton's curve and these all things which are there should be known to you one is increase in size and one is becoming more advanced. Representing your parents is advanced, but growing in size up, you have become a little, you're growing. That means you have grown, no problem. You have grown and you resemble your parents is advancement. You look like something. So not going into the details of growth versus the development, but keep that in mind. There is something called as cephalocaudal gradient of growth. Now this is a diagrammatic representation of cephalocaudal growth pattern. Note the relative increase of the caudal growth relative to cephalic growth with increase of age. Now this is redrawn, from the book again. It is most of what is alarming here is that the head takes up almost 50% of the total body length in the second month of the fetal life, and 30% at the time of birth, and 12% of the total body length. The change in proportions is there. So you have to know that the head size is almost the size of the body when the person is born, and it goes on decreasing because maximum growth of the head has already taken place during the intrauterine life. There are a lot of phase has taken place. So that's how you should really keep in mind when you are drawing proportions. And then these are beautiful diagrams which are there, how the face is going to look like, what exactly the cephalocaudal gradient of growth will be there. Now changes in proportions. The changes in proportions is that growth of the facial skeleton affects the proportions of the head and the face between the infant and the adult. That is how you should keep in mind that if there is a downward and a forward growth which will take place. The maxilla and the mandible enlarge, change rapidly in size and form in early years. A drastic enlargement and change of the lower face is the main factor for the children's face elongated downward and forward. So when you are drawing, whether it is 2D you're drawing or a 3D you are drawing, keep proportions in mind. You have to have a little artistic touch. Too much of art or too much of science make a zombie. That's what I was told. That's a sentence which was told to me by Ozgur Bulut, Dr. Ozgur Bulut, Tübingen University, and a great player in forensic facial approximation. He runs a course in FFA faces in Tübingen University, a very beautiful place. Just before the lockdown, I was there, and I had to rush through. I was supposed to go to Milan, and I had to really, abort my trip because there were 1,500 cases which took place in one day, and I wouldn't have returned back home. Really, maybe 1 or 2 months I would have been their guest if I would have not moved on 8th of March from Tübingen University. But my training was over by then. God has been kind, and after that I was isolated for 15-20 days, and that's a gift I got for my training. This might be a very familiar thing for an orthodontist, but you need to know that these things alter the growth pattern. You should be aware of. You should be consistently in touch with the orthodontist, because most people hear the word headgear and conjure up embarrassing memories of their peer in elementary school teaching them. You must have seen kids wearing them. It's such a helmet type thing which they are wearing. But some adolescent coming of age movie, some 80s movie which it looks like, some sci-fi music, movie. While the stigma of the appliance has been unfairly earned due to its visible nature, it is surprisingly effective in the right scenario, because it really alters the development which is taking place. And you might have a cast or a photograph of an individual, and you might not have a history that he went through a growth modifications which took place. He was using a twin block, he was using a headgear. Don't need to read it. I'm just telling you, franchise it. Involve the best orthodontists around you, and they'll be more than happy, because they're also doing a monotonous job of really getting smiles. Why not get smiles to the other people who are looking for the body of their individual? They are the people who work for smile, and they can do anything for smile. So really motivate them, sensitize them, involve them in your forensic odontology ventures. And so headgear, hot appliance, or Mara, which is there now, mandibular. I really went through vigorous training, and they had a wing which involved orthodontists, and they were casually talking about mandibular anterior repositioning appliance. For me, it was rocket science. For them, it is everyday affair. So really update yourself. At least know the words what they are meant for, so that you can really franchise it well to a person who should be franchised for. So percentages of growth which is taking place: cranium, maxilla, mandible. The cranium activities archive is 87% adult size by 2 years, and 90% by 5 years of age, and 98% by 15 years of age. So you know that most of the cranial growth has taken place, and the brain size is not increasing, and it is not occupying. It is just establishing, good synapses with the neurons. So again, if you see, most of my references is from orthodontics. I'm so much promoting them. Had I been an orthodontist, I would have been a better forensic expert. But you need to have training. You need to have artistic hand also. So all these combinations you cannot have. So I got myself suited for this training. And you have a downward and a forward growth which takes place. Cartilaginous, these all you have learned how mandible grows and how maxilla grows. Go back, read your basics, how things are happening. Now, Bolton standards which are there, the Bolton analysis which are there, these are the series of the standard are the series of average represents optimum facial development and form of baseline understanding assessing cranial growth. I might bore you to really, inspire you to go about reading. You must have got rid of it during your final year. But I will be failing in my duty if I don't tell you that, you need to know about growth and development before you go about, learning. Talking about facial soft tissue thickness. Now you have 10 points and you have 11 points bilateral. If you see, and in the middle, if you see, there is a sticker which is there. If you want to click a picture of a skull, you need to add this thing, because you need to make that picture a life-size one, because these life-size pictures are going to be used in reconstruction. You will be reconstructing on a butter paper which will be fixed on that. That's how reconstruction takes place. So, and the instrument on which you have fixed this is called as craniophore. On this craniophore, you do the reconstruction. These are the 11 points and the 10 points. That is the total 21 points which are there on which reconstruction you can have. This is exactly where the points you have to look for the measurements which takes place on CBCT or which was talked to you. So these, if you have these measurements, you can go about of your local population. You can go about reconstructing. Once you have established that this belongs to this area only, and you have 5-7 people whom you have really zeroed down that these might be this, these are one missing at that particular time, and you can really go about having a local data which is there, and you can start with the reconstruction process. What is the problem with the facial reconstruction is that there is loss of muscle tone which is there, drying of, and soft tissue blotting is there, and then horizontal position of cadaver changes the size of things. So you have to keep in mind that it might be that CBCT data of a live patient will be of much usage than doing on cadaver, that pin method. You try to establish a local. First of all, the medical officer will not let you touch the body. You are damaging it. So maybe an X-ray might be allowed, but I doubt you'll be allowed to really go about puncturing. We respect the dead even more than the living nowadays. So very difficult to really get a permission to really work on the needle puncture method, the needle suit method, the rubber disc long with needle methods. These are all invasive methods, won't be allowed to really work about. Then is a more accurate, that is the CT based, the ultrasound based. One of the studies was mentioned by sir that that I was actually introduced to Dr. Kumuda because of this soft tissue reconstruction, the soft tissue data which she is generating. It's an excellent thing that you are really working on a project which a Mangalore or local population is data is being generated. Excellent thing to have. Might be very handy when you do reconstruction or you franchise your reconstruction. You'll ask for the local data. MRIs, and that is the publication which I was talking about. Dr. Daisy Sani, Dr. Sanjeev, Dr. Gurpreet Singh, Inderjeet, Paramjeet Singh, and this is Dr. Daisy Sani is wife of Dr. Sanjeev, and this is the is a gold standard nowadays in India, at least, because you will not be allowed, and I do not know, they managed for a ethical clearance, you will not be allowed to take MRI data for just for the sake of facial reconstruction or having a data. This was lateral thing. They got somehow the MRI data done, and the thickness on the basis of BMI and the FSCT was observed, and that is how in the North Indian population, Northwest Indian population, how they got the data. Very important: FSCT, nutritional status, age, gender inclination, and ethnicity. Then you should know about something about aging. You should involve a skin specialist. They do so much. Nowadays, it is very difficult to establish the age on the face because people are going for Botox, they are going for hair transplants. Very difficult to really, so much of, artificial thing which is there for getting a correct face will be difficult. It becomes really difficult. You have to be really involving a skin person or a cosmetic person, which can really tell you the wrinkles which are there, the change in the triangles which are there, the change in the hairline which is there, the angling or the prominence of the gonial angle as well as the mental prominence changes. That has to be there. The vertical height of the face changes. The wrinkling happens. The furrow which happens on the just next to the nose has to be kept in mind. This is exactly there is a loss of the facial bone with age. You have to keep in mind, and the relative dynamics of the bone expression and the bone resorption which have to be kept in mind. The structural bone which destroys has to be kept in mind. These are the instruments we play with. How to measure the various places. Once you join this, the training, you will be knowing about them. The craniovernial caliper, the mandibular meter, etc., etc. These are the various machines. Now, talking about facial approximation. Now, till now, I was just building my case. If you want, you can have a break, and we can come maybe 1 minute or 2 minutes. We can have a break, and then we can come for exact how to go about doing facial approximation. If you want, I am more than open, or I am very happy speaking. I'm more of a extempo, so I can speak. Dr. Kumuda, to intervene. If you want 1 minute or a 30-second or a 1 minute or a 2 minute break, let me know. Dr. Kumuda? Hello? Dr. Kumuda?
Yes, Dr. Aman?
Yeah, you want a 30-second or a 1 minute break? Or
yes, you can take a break if you wish to.
Okay, we'll take a break for 30 seconds.
For? 30 seconds.
We join in 30 seconds. We'll have a glass of water, everything, and we join in 30 seconds.
We will be back in 30 seconds, about a minute or so. Please bear with us.
Okay, let me know when we are ready.
Dr. Aman, I think you can carry on.
All right. Yeah. I'm sorry. Actually, I have a non-infectious sore throat, so I
Okay.
had to take water. Don't worry
No
about
problem.
that. Nowadays, if somebody has a sore throat, he is positive for something else. But I have a sore throat because of some cold. So I got my RT-PCR done. No problems with that. Now we proceed with the thing. Is it visible now?
Screen sharing. Is it visible? No, not yet, Dr. Aman.
Just a moment. Is it visible now?
No. Yes, now it's visible.
Okay. Okay, the rules are the same. Please switch off your mics and we can proceed now. Forensic facial approximation, art and science. Now, you need to do the same thing so very often, so perfectly. That's what I learned over the years. Dr. Jasuja, Dr. Sanjeev, Dr. Osgur, they have been instrumental in learning, and I see persistence from various dental people also. So persistently, they are doing the same picture. If I enter the orthodontic department in my college, they click pictures for each of the patients, and they are doing the same thing. And the aim is one single thing: getting a smile. Getting a good smile, getting gives them satisfaction. And same is the aim of forensic facial approximation. We want smile not on the cadaver, but we want the smile on the people who have been searching for their body, for the body of their loved ones. Establishing an identification and giving a body a name, giving a body an identity is the prime motive, the paramount motive of our thing. So this has been this definition has been told to you. I could see this is the exact definition which was told to you in the earlier lecture. But just to add a flavor to it, you have seen a sofa set. Must have seen a sofa being made. On which you should sit. This is exactly the framework which is there is given to you. You have to build a sofa. The soft tissue, the cushions which are there, has to be added to get a face, which is recognizable. I don't say it is forensic facial approximation or it is forensic facial reconstruction. Now, this is the term which is used. It is closer to the face. And as your science grows, as your artistry grows, you might be closer to the individual which was diseased. But at first attempt, it will be very difficult for you. If somebody wants to train, I train them for ear first, nose first, mouth first, eyes first, reconstruction separately, and then you come up to a reconstruction process. You should know how the anatomy, how a feel of a nose is, how types of nose, how to have a dexterity of hand, first of all, to reconstruct. So unrecognizable corpse reports to you. Then you do tentative journal identification, notify the public. If the relative comes forward, well and good. You go for a specific identification, dental record, fingerprint, DNA analysis, superimposition. All this can be tried only if you notify the public that this body is there, and he recognizes by by the clothes he's wearing, by the appearance, maybe the blotted body he tries to identify. There are some specific features. A tattoo is there, or something is there. What if not? Because then you have to do a reconstruction, because you do not know how to match with what. To match with DNA. There is nothing like a DNA, because DNA is comparative analysis. There is nothing like. So you have to go for a manual 2D or a computerized 3D reconstruction. And notify the public. Now, if the relative comes out, again you do the specific identification. If not, keep the record, bury, end the process. This is important because if you do not follow these steps, you are not following the rules of the game, or you're not following exactly, you're not respecting the body which was there. You have to really be patient, really have patience to go about reconstruction. But usually in a country like India, where so much of casualties happen, it is difficult to really follow all these rules. So what exactly a facial approximation workflow is there? Preparation, anthropological analysis, and reconstruction. Preparation is manual, digital manual, and digital. Now, manual is reassembling, remodeling, cleaning, consolidation, molding, casting, and mounting of the skull. This is how preparation is done for manual reconstruction. Then there is digital manual, that is 3D reconstruction, 3D scanning, 3D post-processing, 3D printing, mounting of skull, and then is the digital one. Then there is 3D scanning, 3D post-processing, import into free form, reconstruction of software. So this is exactly the process when used there. You can have a manual, a digital manual, and a digital. Now, if you really want me to elaborate, manual will be you get a skull, you either replicate the skull by then you directly work on the skull and rebuild it. That is manual, mount it and skull. Digital manual is you do partially. You replicate the skull on 3D by 3D scanning and post processing, and then printing it and doing a manual reconstruction on it. And digital, complete digital is that you 3D scan it, you 3D print it, or you don't print it, you do it in a virtual world reconstruction. That is exactly. So once you get a skull, you totally digitalize it and do the digital thing. That is a digital one. Digital manual is you digitalize the skull, take a print, and then you manual is directly. So there are three methods which are there. You can go about reconstructing. So these are the three ways you can go about: receive a skull exhibit, 5 essential documents, post-mortem report, SSP document, FIRE, sample exhibit, road police certificate. Now, why am I giving you this chain of custody? Is that if you break through any of them, the culprit might escape. Because you being a doctor and not knowing the rules of the game of forensic science becomes. I learned it because people of forensic medicine, forensics are my team. I was because I was little now I've equipped myself that it is very important to know the rules of the game. It is very important to know the rules of the judiciary which has to be followed, because you come under the country, you what exactly just by a silly mistake the person might escape, that some tampering might be proved that it was done and their chain of custody was not followed, and then many of the cases which have been shown to you might go in a hayride and they might delay the justice as well. So this is a replication of skull. I was not allowed to use in my university. The ethical clearance is difficult. What you might not get in any university to really work upon skull, just to give a demo on. So what I did was I bought a acrylic skull from Amazon, and then this is exactly how you replicate. It's very easy. Might be a rocket science for people of other branches who are learning, but for a dentist, putting a modeling wax and making a cast out of it and putting an alginate on it and then taking a negative replica of it is very easy. Just that you have to have a 4 or 5 bowls, interns standing next to you who are mixing the plaster, and then they pour it first the alginate, take an impression, pour it, put plaster on it, make a cast out of it, and then pour stone in it, and then remember to apply Vaseline on it. So that's how you can replicate. This is by the famous Dr. Shadi. He's no more now, but then his work is beyond replicable. His hand is beyond. He was a forensic medicine person from Turkey. Many books Iskan and Sadir has written. Now Iskan is no more and Shadir is there. I'm really sorry. I'm really killing him. He's a good friend. And then Iskan is the person who trained Dr. Jasuja as well as Shadi, and I happen to be the trunk ahead after them, learning science from them. Then Salma Eka is there from Turkey. So this Turkey people really are good at art, and mind you, the Ozgur, Dr. Ozgur is again also a Turkish person whom I worked with in Germany. So a lot of intertwining of anthropology takes place when you're learning about a thing, and a lot of dental background they have. These people have. There are people who are trained in forensic sciences as well as dental anthropology. That's what makes them really strong contender in the team of FFA. Skull orientation. Now, this is the Frankfurt horizontal plane on which we put the skull on. Might be exciting for oral medicine and orthodontists, because they use this plane for taking X-rays, and these for a orthodontist they use this FFA plane for reference. How to put a skull on a thing is that I've clicked on the video here. Okay, so this is exactly how Cranio 4 will look like. This is a picture taken on just outside. You should know how to click a picture also. This is mounted on a tripod, and then you can click a picture of the skull, and then you can go about superimposition or maybe a 2D reconstruction of it. You have to have a standard thing. You have to have know how to click a picture. You should have a DSLR. How to use that camera. How to play with the focal apertures as well as the ISO. Again, I will emphasize, orthodontists are the best people who are clicking pictures. They should really learn from them how they click pictures of facial profiling. I'm promoting so much of orthodontics. I think next time Department of Orthodontics is going to call me. So how to go about 3D imaging? Now 3D imaging is you have to microscope. These techniques which are there is microscribe. Then there is developing of digital models through photogrammetry and 3D surface scanning. That is laser and structured light, which is there. Then there is micro CT scans. And then is confocal microscopes. Talking about microscribes, now studying geometry and add manual landmarks and it reads the geometry. That's how a microscope is done. You put spots, dots which are there, and they read those dots, how they are placed, and they are able to get a geometry. Now, developing a digital surface model can be done with multiple photographs taken, and they can be aligned. That is Polymus, that is from US, and Arctic. Arctic is Russian. Now, these are the two things. I'll show the picture also. I've worked with that also. Now, talking about micro CT scanning, that is the internal bone structures which are there, that you have to have a DICOM to object STL file which is generated. Now, what you get is a DICOM file which has to be converted to a object STL file. The object file which is there is the difference between the object file and the STL file is that object file is a size is large and texture is also recorded, which is not required as such for a forensic facial reconstruction. STL is the size is large and the texture can be imported later on. You can add texture later on. So I recommend use of STL file. So you have to know how to convert object file which is there. Dr. Kumuda or Dr. The oral medicine department is what it generates through a CBCT will be a STL file. Now this has to be a DICOM file. Now DICOM file has to be converted to a STL file. Then there are confocal microscopes which are there. Confocal microscopes are specific areas, very specific. Increased resolution is there. We do not require in forensic reconstruction as that. What you use is mostly an Arctic one. From outside it takes a continuous pictures and generates an image. Now you should know what is the anatomy of a 3D model. I've shown you 3 balls which you are seeing just below. There is each unit is having a vertex that is the smallest unit of a single 3D point. It is having an edge which is the line connecting the 2 vertices. And there is triangle. A triangle is formed by 3 edges. A polygonal face which is there, the top face which is there is a flat surface defined by the edges that are the triangles. Larger or fewer triangles, the number of triangles is more than the detail is more. The smaller the smaller the number of triangles, smaller the triangle and number is more, it gives more detail. So what exactly that is how 3D imaging is there. People are working so much in oral medicine and orthodontics in facial scans. They are doing facial scans and a lot of work is being done in we recently had a conclave on obstructive sleep apnea, and there was excellent amalgamation. Again, I was so excited to see a lot of facial scanning which was happening. Dr. Harold was there, Dr. Priyanka made the conclave possible under the banner of Indo-Pacific, the IPL group which we learn, and Indo-Pacific Forensic Odontology Academy was the supporting force behind it. Then there is 3D scanning which is there. 3D scanning, processing and 3D printing. You should know about 3D scanning. The principle which is there is a laser light beam is first made to fall on the object and reflects the 3D object and changes the trajectory, and we record it. Types can be laser triangulation, and I'm not going. Once you are into 3D printing and scanning, you can really understand how to go about doing it. The advantages. Now I came across this, at least for a tooth can be done. You can download QLone app on your phone. You can note down QLone 3D scanning app. You can go about seeing in the YouTube. There is a dome which will be generated. You can take a print of a grid, keep a tooth on it, keep a small cast on it, run your phone around it. It will start clicking pictures and get a complete picture of what exactly thing is there, and you can take a print also, a 3D print also. I'm promoting QLone on this platform. Then there is GOMS, which is the GOMS launches that is a TOES capsule which is there, which can really precise measuring can be done. A picture right to it is from Tübingen University. That is the next engine which is there. This is the Artex Spider I have used as a 3D scanner. Very, 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 very easy one to really scan. You can scan complex structures to face to easier structures. Now, once you have it, you do a post processing. Once you have a picture, once you have a 3D image, a file is there. then you have to do the cleaning, because it will be scanning the lower halves also. It will be scanning, they'll be having a lot of impurities. There'll be punches which are there. You have to fill those. You have to do the repairing. You have to do the reconstruction, a little bit of reconstruction maybe, if there are holes which are there. It is just like you can compare with the cast which you have poured is having pores in it. You really tap it, and this is called as post-processing. 3D printing can be done. Then later on after that, if 3D printing is done, you will do manually. If you don't do the 3D printing and you construct on the virtual background, that is complete 3D reconstruction, that is computerized reconstruction. So reconstruction, before reconstruction, you should do the reconstructive identification. You have already been introduced to reconstructive identification, that is anthropological analysis, determining the age, dentition, ethnicity, and sex from a tooth. You should know what you should ask what exactly will be the facial contour from the orthodontist. Then determine the sex. Sex can be determined by William and Rogers' 6 principles. 94 times you will be right that, having what kind of orbit, the gonial angle, squarish, roundish face, the weight of the skull, mandible, etc., etc. I'll just skip through. You can really go about reading the sex determination from skull. Just keep in mind, 95 times you'll be right if you are equipped properly, if you are reading it properly. More male, more female. We take the noting like that. I spend 80% of my time of my reconstruction in analysis rather than reconstructing, because if you have done a good analysis, your reconstruction will be easier. You will be able to give male features, female features, or hyper female features, which you can give. You have to really go about, have a good data first generated from the thing. You can go about, it is a era of self-promoting. I'm promoting my book. This is a chapter in it written by Dr. Jasuja, Dr. Priyanka on osteology and archaeology. This is about how craniofacial osteology can be applied. Now, deriving ancestry from skull. Ancestry, that is the ethnicity from the, if it is usually Caucasian type, Negroid, Mongoloid type, and Australoid type. Now, if a Caucasian skull is there, or a Negroid skull is there, or a Mongoloid skull is there, for an anthropologist it is very easy, because they can tell from the upright or a sloping or a flat cheek profile that how it looks like. Orbits play a very important role. Nasal apertures play a very important role. You should know about, don't end up writing blacks and whites and browns. They call us white, they call us brown, we call them black, is okay. But then as a scientist, it becomes a little controversial that you are a very racist, if you are giving blacks and whites and such kind of inferences which you are drawing from your data. So that's how nasal width, wide palate, rounded orbits. Now get equipped yourself about these things so that you're able to write proper report before you start reconstruction. The filling of the data will play a vital role when you are going about reconstructing. I've tried to compile various kind of skulls. These are artificial ones. They're acrylic poured skulls, but they look more of real ones. Many of them are, you might got doubt. So in an era where there are a lot of rights for the dead, you should really avoid clicking pictures without permissions. I've seen people getting into trouble by not knowing the law. You have a cranial index which can be taken, that is there, and then you have a facial index which is there. Now, cranial index is you have to keep in mind that cranial index is based on the visual equivalence of the right urion, left urion, and the glabella and the occipital anthropological landmarks. Now, this has to be that you can derive that it is a dolichocephalic or a brachiocephalic. You have to know that it is a long-headed or a medium-headed. So you can have a facial index which is there. Again, same way that you have measurements which is taking place according to the left and the right zygomatic and the nasion and the Mathian points. This is exactly how you measure it, and then you get what you get is a facial index, the NGN or the ZYR ZYL line, which is there, and you try to get the proportion, and you're able to tell the cephalic indices and the facial indices usually, and that's how you get the skulls which are there. So I'm not killing them. I'm just for getting your attention. I use those pictures. Age from skull. So many sutures which you learn, they fuse at a particular time. Once they fuse, they keep on having various changes which takes place. You can have a sigmoid, a lambdoid, a square muzzle, a frontanel. These are all very important to know. Female feticide is so prevalent. You might get a very small body size things might come. You should know about the various suture closures which are there, and you should be able to recognize if they are fused, what to call them, and you might be able to generate age out of it. Mandible also plays a very important role in determining the age, the adulthood, how the mental foramen moves down or upward proportionately, relatively, is exactly how to go about. Gonial angle might be very important. Talking about the workflow, now we have done the preparation, we have done the anthropological analysis, and now we are up to reconstruction. Now, when we do a reconstruction, reconstruction is done with a method, either it is a 2D or a 3D. 2D is done on a paper, which can be a radiographical or a graphical method, and then what you have is the 3D facial approximation, that is through a manual or a computerized method. Now, computerized, there is a midway also that you can have a digitalized manual method. I told you just now. Now you can have a digital. Now, if you are doing a manual method, it can be anatomical, that is a Russian method, anthropological, or a combination method. When you're doing a computerized, so many of these softwares I have mentioned, and you can go about reading about them. I will mention, don't worry about them, I will be mentioning them. Sheena Bora case was mentioned. Then there was there are various cases which have been cracking through these bone by bone reconstructions. The method which I manual are Gracimos, Gatleff, and Neves. Grasimov claimed it to be 100%, and he has proved I fail that, I think many scientists have failed, and it is a difficult method to really conquer. What we use is the combination method, that is the Russian plus the American method which is there, that is the Manchester method. Now this is exactly the combination how we goes about methods of forensic facial approximation, that is the FFA, 2D, 3D, radiological graphical, manual, anatomical Russian, that is anthropological, and computerized. Again, those points, step markers where you have to go. This is the reconstruction of nose. You should know, it is beyond scope to really teach you how nose has to be made. Nose is made by, read about Grasimovs, Krogman, Postweb, Rubilker, George, and recently Smith, and recently Christopher Ryan. Just search Christopher Ryan and you will get all these nasal types, nose types. Now you can go about designing a study on just the nose type as well, or a chin type. These two studies can be done once you're already generating data on chin or on soft tissues. Those 100 data can be utilized for nose. Separate study can be designed for nose as well. In that only. Though keep in mind that we do not promote salami publications, but then if it is a big project and separately designed just for nose, why not utilize that? Because it is an era of so much of data. So presenting data might help you, or you can have just a mention of nose as well. It can be a part of part 1, part 2 also of your study. I'm not including your study, but then I'm just giving an opinion that since you are already working so hard on CBCT. Grasimov's 2 tangents are drawn, and then you have a nose which is generated. Nasal bones can be a pronasal, etc., etc., etc. Please read, because beyond scope really to teach you all 7 methods of how to get a nose, like accurate nose. Digitally can be done or manually it can be done. thickness of lips, blades of incisors, how they determine the mouth size, where the lip is going to rest, where the nose is going to rest, what will be the size, breadth of the nose, the vertical guides of the two vertical guides which are there from the pupils, which is there, the nasal aperture, how it goes about. Very important to really go about. I'll recommend you a book which is there, that is by Karen Taylor. That is, it has got beautiful illustrations on 2D reconstruction. So what right now we are talking is imagining a face and getting a face which is near to the real ones. The shortcoming of this is that it is insufficient data is there. The subjective nature of this, there is lack of reliability and standardization is there. Keep that in mind. What we do here is that at this point we have tissue tags which are put. The tissue tags are of the size of the data which is there, and we try to build nose on that with the help of clay if we are doing manually, and we try to rebuild with the help of digitalization if we digitalize it if we are doing a 3D computerized reconstruction. If you see in this, we have added facial fat, we have added a parotid, we have added so much of detailing. We have added the pictures which are there down below. You can see the various facial muscles which are being added: the platysma, the temporalis muscle, the muscles of mastication, the ocular muscles, and very, very scientifically we try to blend them and then merge them. Talking about advancements, digital 3D reconstruction. If you see 3 logos I have put. Now these 3D logos are very, very important if you are doing a reconstruction. One of them is the freeform which is there, the 3D system which is there. Then there is a blender. Then there is the instrument which is in my hand. If you see, this is a tuck back haptic system of TouchX. It is a class apart reconstruction which happens with this. In this, usually when we are reconstructing, we are constructing it on the face, or if we do a reconstruction on a digital thing, we are not able to touch. With this pen, we go inside the virtual world and we are able to reconstruct. You press the button, it will add clay, and then you can start. It is a tuck back. You can feel the skull which was scanned 3-dimensionally. I told you we convert it into a OBJ file, and then we start working on away from the DICOM data which was generated from CBCT. Various softwares which are there in Willis's, C3D. We have Make Human, Haptic Feedback, Freeform, Blender, Composite, ZBrush. Various softwares which are there. I've tried my hand in a couple of them. Blender is free. You can download it and you can start working on them. You can start with basics and have a feel of how to use a mouse, and then you can go about. I did not invest so much of resources till I was pretty sure that I can do manually, as well as don't go about going for a digital reconstruction when you're not knowing the very basics of anthropology, as well as you're not knowing basics of reconstruction manually. We'll be wasting a lot of money for no reason. This is a haptic device, the TouchX, which I talked about. That I have worked on TouchX. There is Touch also available. Both of them are very, very handy in reconstruction, and they are present in the Manchester University, Tübingen, and Interpol. In Brazil, I came to know there are 5, 7 places only which have developed a anthropology TouchX lab. We might have in India also, maybe sometime, but then we are able to manage on a software which is not TouchX. But it takes a lot of hard work, but we are used to it, so no problem. We're able to manage on Blender. We are able to manage on some kind of digital platforms which are there freely available. We tend to put a project on it. Maybe if it gets approved, we might have better software. But right now, as of now, we have texture adding, and we have various apps which are there, which can be utilized on. But you need to know what exactly you're looking for. You have to don't end up creating zombies which do not look like human beings at the end of the day. Being highly subjective, inaccessible to remote areas, time consuming, requiring artistic talent. All these 4 things, if you have, you're able to manage, you can be an excellent FF or team. This is the DICOM data. Before I finish, I need to tell you that, soft tissue skull or the skull chart which is there is available with me. You can go about reading it. And the Aviso is a software used to convert DICOM file to STL file which is there. The post-processing is done on GOMS. Rhines and Gracemos should be tried at your population as I recommended for nose. Then the name of the clay which is used is the Shavant NSP 3 kg medium. That's what we buy on Amazon, or it is unavailable. You can buy from Amazon.com rather than Amazon.in. It will be very expensive, but then you have to do what can we do. Then there is facial aging chart which is available. You can download it. Then the placement of eye is 24 mm eyeballs which are there, and it should be 3.8 mm out. Then there are eyeballs which are there, that is KL Glass 1. Camper dolls, again Amazon.com. You can buy those eyeballs and you can fit in. You can go to an ophthalmologist and buy 24 mm, 28 mm, 24 mm eyeballs and can fit it, because it will be more Indian. What you'll get from abroad is a bluish hazel green. Such will be unrealistic for an Indian reconstruction. If you need to know about few cases, this is I'll cut short, not giving the details. This was reported and then reconstruction had to be done. We cut out the approximation, and if you see opinion was there, and then we generated a thing that what exactly was there. Adobe Photoshop was there. I took help from an orthodontist, Dr. Priyanka, helped me out with the what will be the facial profile. This is one of the cases which is there. Roadside. They send me this. They send it on an open platform and then ask for an opinion. Very difficult to really tell a face out of this. The chart. A person was burnt and thrown next to the roadside. Now I cut out. I told the investigating officer to send a picture. He had a point and shoot camera. Did not keep ABFO scale next to it, but still clicked the picture, and then what we got was okay. So you see an orthodontic perspective was added, and then reconstruction happened, and what exactly was there was this face was drawn, reconstruction happened, and then we could really go about the closing, or I sent it to the concerned regional officer of Kangra, and then things. This is again one of the cases where a child went missing, and then how superimposition happened and how reconstruction happened. Not details, just a fascinating world of superimposition also. Not only a reconstruction and superimposition are two different things. Again, both have anthropological basis, but then you should know how to reconstruct face. That's how I want my house to be, full of skulls, though I'll be kicked out if I do that. My dream is to have a skull lab someday, and I have just quoted our missile man. Workshops happen. We do a workshop on rugoscopy. We do a workshop on Demergent chart. Demergent devised by indigenously devised in our university. It is by Dr. Priyanka, Dr. Vanshika. They have abridged approach towards Demergent. We do workshops on forensic facial approximation. And I need to promote my book as well. You can go about reading. Thank you so much, guys, for patient listening. It has been a long lecture. I'm open to questions if required. Dr. Kumuda, you are mute.
Anybody has any questions? We have two questions. One was, which are the materials used for facial reconstruction? I think you are covered up. You can just tell once again briefly, Dr. Aman.
Can you repeat the question? What exactly you are asking?
Which are the materials used for facial reconstruction?
Material I just mentioned, at the end of the thing that, a Chauvenant clay is available. You can buy it. If you can, I'll send you the exact name of the clay. You can, if you are really starting initially, try those, student clay or the Camlin clay. Have a hand on it and then go about using expensive ones. Don't end up buying just for real things.
The next one is by Dr. Akhila Shetty. Is facial reconstruction always accurate?
I did not see. Is facial reconstruction?
Facial reconstruction always accurate?
Always accurate. It is recognition. It is not reconstruction. What you take it closer to the reality so that the body can be identified. See, if you see that how much times it is, as you take it, everything cannot be DNA. You have to derive some science to it so that a DNA can be added. It is the missing link between the science and the art. How much science, how much art is your thing. If you are closer to both of them, you are at perfect. So like Gracemos had 100% accuracy. Nowadays, if you get a face maybe a 80 to 85% correct, you have done your job, I feel, because it's an you are modifying by your hair, you are dyeing your hair, you are coloring your hair, your racial diversity is there, you are traveling so much, intermingling of populations is there. You cannot have a accuracy of that sort which was earlier. But yes, you have to do something with the body. You cannot just close like that. You cannot do without adding science.
That is all, Dr. Aman. I think
great.
We can proceed with anybody, any questions? I think, we can proceed with the vote of thanks. I request my colleague and the forensic coordinator, Dr. Urvashi Shetty, to deliver the vote of thanks.
Very good afternoon to everyone. On behalf of the Forensic Odontology Unit and Dental Education Unit of our institution, and also Indo-Pacific Academy of Forensic Odontology, I, along with Dr. Kumuda, extend our heartfelt gratitude to everyone who has helped us in planning and execution of today's webinar on forensic facial reconstruction. We are highly indebted to Nikkei Dean University for supporting all our endeavors. A special thanks to the chief guest of today's program, Honorable Vice Chancellor Nikkei Dean to the University, Professor Dr. Satish Kumar Bhandari, for gracing this occasion. We are also grateful to our resource person, Professor Dr. Aman Chaudhary and Professor Dr. Mablesh Shetty, for accepting our invitation and contributing to today's program. We would also like to thank our dear principal, Professor Dr. U.S. Krishnaik, for his continuous support and encouragement. Our heartfelt thanks to our senior advisors of the Forensic Odontology Unit, Professor Dr. Pushpraj Shetty and Professor Dr. Subhash Babu sir, for their continuous support and guidance. A special thanks to our postgraduates from the Department of Oral Medicine and Oral Pathology and also the interns for their assistance. Finally, I would like to thank all other participants for attending this webinar on forensic facial reconstruction. Thank you all.
Thank you very much.
Thank you very much.